Interprofessional education is a collaborative approach to developing healthcare students as future interprofessional team members. Recommended by the Institute of Medicine, interprofessional education allows trainees to share skills and knowledge between professions while creating better understanding of shared values and roles. Its early introduction helps build value and respect for working within interprofessional teams.
The healthcare system is changing at an unprecedented rate. We're transforming from a doc-in-the-box, single clinician serving an individual patient to an era where teams of clinicians, teams of other types of health professions, social workers, health workers, outreach workers, nurses, etc., are all going to be working in teams, caring for a population of patients, trying to improve the care and the outcomes of that care, as well as the experience of care for that patient population. And that's the only way we're going to control costs, as well as get better outcomes from the American healthcare system.
So how does interprofessional education of health professions trainees fit into interprofessionality?
There's always interprofessional team leads, so tonight we will be yours.
Reflection and teamwork that includes interprofessionality encourages communication and cohesiveness by all members of the healthcare team. Ultimately, this better serves the needs of patients, clients, and their families.
Many of the problems we've had historically in American healthcare stem from the fact that our different disciplines don't really understand what we're each capable of.
If there's not too many patients, they can join one of your teams.
So the way that you actually teach interdisciplinary teams is by having them together, working on a problem.
It takes more than just all being put on the same team to provide effective care to people.
Interprofessionality requires a new way of thinking about healthcare delivery. Interprofessional practice has unique characteristics in terms of values, behaviors, and work process. Drivers of interprofessionality include accountable care organizations, or ACOs, accreditation standards for professional schools, and the Triple Aim, which focuses on improving care, improving health of populations, and reducing healthcare costs. Interprofessional education is when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Interprofessional collaborative practice is when multiple health workers from different professional backgrounds come together with patients, families, careers, and communities to deliver the highest quality of care.
Because when I had training 20-something years ago and I was at the Yale PA program, it wasn't a hot topic thing. It wasn't a big thing, interprofessionalism. I can't remember ever hearing that. But now it's everywhere. I've learned a lot myself, and I've brought it to my own practice.
We know that team-based care improves patient outcomes, and we only expect to see more of it in the future. So preparing them from the beginning for this is really important.
For this patient here,
the delivery of high-quality patient care is challenging. It requires that healthcare professionals work effectively together. No small feat in a fast-paced, stressful, and under-resourced environment. Used effectively, interprofessionality results in better use of clinical resources by supporting all healthcare professionals working to the top of their license while reducing tension and conflict. Equally important, interprofessional education can impact trainees' attitudes, knowledge, and skills.
A pharmacist can help you with managing medicine, but the pharmacist can't find a place for the patient to live. It's great if you find specialists for your patients to see, but you can't get transportation for the patient, and that's where social work can come in. And just reaching out to people on the medical team who have had the same types of scenarios as you have.
Team-based care isn't new to the training of health professionals. Geriatrics, intensive care units, and the Veterans Administration long have embraced the team-based care model to address the complex and challenging needs of patients. In 2009, 2010, and 2011, the Interprofessional Education Collaborative, or IPEC, brought educators, healthcare professionals, and policymakers together to examine the role of interprofessionality, the core competencies for interprofessional collaborative practice, and language. 6 major health professions training programs agreed to endorse the recommendations found in the seminal May 2011 report.
In some of the specialties, we've been doing team care for a very long time. In geriatrics, we've done it forever, and I think the reason we've been doing team care really helps to illustrate why it's important for the entire healthcare workforce. In geriatrics, we use team care to reduce risks, improve outcomes, really improve quality of life, functional status, all of the different elements that members of the healthcare team can bring to improve a patient's care go together for an older patient.
I think if you haven't been exposed to working as a team as a student, you don't have that reflex to go ahead and do that when you're a provider. it's okay to not have all the answers. Nobody can do it all by themselves. It truly takes the whole medical team, and so modeling that to students is so important.
Central to collaborative practice are 4 core competencies: values and ethics, roles and responsibilities, communication, and teams and teamwork.
One of the competencies is values and ethics. Now for me, the most important value in healthcare delivery is patient-centered medical care. So no matter what we do, every action we take when we're working with patients, we should always keep the goal of patient care in mind and the wellness of the patient in mind.
Another important competency is team and teamwork. As different healthcare professionals, we bring different unique skills and abilities, and when they come together, we can provide the most efficient and effective patient care.
Perfect. Yep.
And another really important component is interprofessional communication, and not only that, but communication with the patient, and just making sure that as we start to work together, we figure out like the things that we're best at, like you said, like working as a team and figuring out what we each can like communicate to each other about what we're treating the patient.
Interprofessionality delivered through interprofessional education adds significant value to health profession student training. Learning the vocabulary, expected behaviors, and core values makes the training experience richer and more impactful.
So it was a really wonderful experience. I learned a lot, more than I expected tonight, even though I came to give. So I'm really happy about that.
Just everyone was just really great at adapting to that and adapting to everyone's different styles of like taking histories, doing physical exams. So I thought that was really, really amazing.
Just talking about adaptability, like we just treated patients with no privacy, no rooms, no chairs, no anything, and we definitely adapted to the environment, and we adapted to each other and worked with each other. And I mean, I learned so much when I'm out here. I hope that everyone can take this opportunity and see how much we can learn from each other and teach each other, and have it like inspire to us to continue to do that.
The Connecticut Area Health Education Center Network at UConn has been involved in interprofessional education and training of health profession students for more than a decade. Through involvement in programs like the Urban Service Track, Migrant Farm Worker Clinic, the Got Care Geriatric IPE program, the Dean's IPE Afternoon, as well as local free clinics, trainees are immersed in valuable community-based interprofessional experiences. To learn more about interprofessional education at UConn, please visit these websites.